Human trafficking is the use of force, fraud, or coercion to exploit another human being. With children, there is no need to prove force, fraud, or coercion because they are minors. The average age of entry is 12. It's the fastest growing criminal enterprise. It's grown since we first began working with trafficking victims in 2012, from a $30 billion criminal enterprise to a mind-blowing $150 billion enterprise. 79,000 children in Texas are being trafficked. And that's just the tip of the iceberg. The Jeffrey Epstein case brought the issue to the forefront in our nation, and our laws and recovery services have strengthened. However, this has not stopped the growth of the criminal enterprise. It's so lucrative, it's hard for criminals to ignore. They can sell a drug or a gun once, but a human you can sell over and over and over again. And children are the most at risk. 87% of children rescued from human trafficking have been in the foster care system. That's where we are concentrating our efforts. A human trafficking victim may develop a mindset of fear, distrust, denial, and conflicting loyalties. They may distrust authority figures, particularly law enforcement and government officials. Similarly, traffickers may convince sex trafficking victims who are U.S. citizens that if they report their traffickers to police, the police will jail the victim for prostitution while the traffickers, pimps, and johns will go free. Many victims of both sex and labor trafficking fear that if they escape their servitude and initiate investigations against their trafficker, the trafficker and his or her associates will harm the victims and their families or others. Being able to recognize the psychological and emotional consequences of human trafficking can also be helpful in identifying victims. Victims often develop general feeling of helplessness, shame, guilt, self-blame, and humiliation. They suffer from shock and denial or display symptoms of post-traumatic stress disorder, phobias, panic attack, anxiety, and depression. They suffer from sleep or eating disorders, become addicted to drugs or alcohol to cope with escape of their situation or as a method of control used by their traffickers. They become emotionally numb, detached, or disassociated from the physical and psychological trauma and display flat affect or experience trauma bonding with the trafficker, positively identifying the trafficker as believing that despite repeated abuse, the trafficker is a loving boyfriend, spouse, or parent. While not all victims of trafficking have physical indicators that aid in identification, many victims suffer serious health issues, some of which may include signs of physical abuse, such as bruises, broken bones, burns, and scarring, chronic back, visual, or hearing problems from work in agriculture, construction, or manufacturing, or reproductive health problems, including sexually transmitted diseases, urinary tract infections, pelvic pain, and injuries from sexual abuse or forced abortions. Chayah's mission is to fill the gap in the areas that are currently not being addressed at the level they need to be. One area is capacity in general, and the other area is including the family or foster family of the victim. We call this wraparound care. It is the loving, caring family support that is the catalyst for long-term healing. The wraparound team consists of the parents, the child, the counselor, a psychiatrist, a medical doctor, an equine specialist, a music and art therapist, a life skills coach. The team is individualized according to the needs of the family and the child. And we also provide trauma-informed tutoring and educational assistance. What we need for our mission to succeed is foster parents who have a heart for deeply wounded children, who are committed to the care of the child no matter how difficult it is, and funding for operations and sponsorships for children and their families.